Good afternoon. My name is Victor Carrasco, and like Barbara had introduced me, I work for the Leukemia and Lymphoma Society. I am the patient services manager for the territory of the state of Arizona. So I'm very happy to be here. It's my first time up in Window Rock, and I just want to say thank you for inviting me, for inviting the Leukemia and Lymphoma Society and myself to come up here. Today, since it's been a very, very productive day today, I'm going to try to be as quick as possible in the interest of time. My presentation is going to pretty much just orientate you a little bit on what a family support group should look like, or at least our version of it, because there is no one, way of doing things, especially support groups. Next, please. So very basic objectives. We're going to talk about some counseling skills, what the structure of a support group should look like, orient volunteers to characteristics of a family support group participant, what a participant should look like, and what a facilitator of a support group should look like. Next, please. So this is the Leukemia and Lymphoma Society's definition of a support group. But like I said, there's not one mold, there's not one way to do things. Certainly, we talked about earlier about cultural sensitivities, and that's something that I think is very important in any support group. And if you look at cultural sensitivity from a provider point of view, from a support point of view, from a caregiver point of view, all those items have to be taken into account. If a provider sees the need for a family to go to a support group, it should be, it should almost be a given that that should be provided. Sometimes that doesn't happen. I've seen that, and certainly in Metro Phoenix, because we're still going through that transition of knowing that support groups are a good thing. They help heal, they help you get through those initial phases of confusion, of your own feelings, and the feelings of your caregivers and your family. Next, please. Next. So we're going to talk a little about communication and empathy. Communication, as the slide talks about, is effectiveness in relating to others, whether friends, family, or people in authority. Depends on the quality of our speaking and listening skills. And of course, there's different responsibilities with those two things. Next. So here's the responsibilities of the speaker. In other words, when you're speaking when you're in a support group setting, or even amongst a conversation in itself, there's certain responsibilities speakers should have. Before you even speak, try to organize your thoughts before speaking. You ever heard about that? Think before you speak. That's pretty much a very, very basic concept. Check to see if the listener understands what you're saying. Am I being clear? Am I communicating clearly my idea, my concept? That's important. Check to see if the listener is involved. There's different cues that the listener can have. Are they leaning forward? Do they have a frown look on their face? Do they look down if there's a certain specific word that you might have said might have triggered an emotion? Is there a certain way that the person is sitting? Their body language is important. So reading that is also, it makes you a good speaker, because then you can be able to address those issues. So when you ask questions, be sure to listen to the answer. Again, take the verbal cues and the nonverbal cues from the answer. If the person is hesitant to ask, maybe you want to restructure your question, or if the person drags on the answer, it doesn't really tell you maybe what they're feeling, or what they really need to tell you, whether it's in a provider-patient situation or a family support group situation, where the support group facilitator asks a question, and those around in the support group really don't answer either immediately or hesitant. That's very important for the speaker, because then you're going to have to go back to that cultural sensitivity part and think, well, who am I asking, and is this relevant? Next, please. So here are the responsibilities of the listener. Just know that there's more responsibilities to be a listener than to be a speaker. Very basic things. When you listen, concentrate, and be attentive, that's very important. Look at the speaker and face him or her while he or she is talking. Again, this we were talking about earlier, the traditional healer was talking about when he grew up, that looking at somebody was not, was considered disrespectful. Like I said, keeping in mind the cultural portion of a support group is very important. So here's a good example of that. The speaker talks at length, intervene occasionally to remain involved. Again, it goes into those verbal and nonverbal cues. Ask for clarification if they're confused. Respond with positive regards such as nods, yes, it goes back to those cues of being a good listener. Concentrate on listening. I don't think we do a lot that. We don't do a lot of that. We don't concentrate on listening. Especially if you get a diagnosis of cancer, you don't listen to the rest of the conversation except the word cancer. That's very scary to a patient, especially if they go by themselves to get those results. Bring an advocate, bring a family member, bring a recorder. Definitely something good to do. Whenever appropriate, summarize what you believe in is the content of the speaker's message to check your understanding. This is extremely important, specifically for when there's language barriers, or if there is a child involved. In my culture, I'm Mexican, we see a lot of the children translating for the parents. That's very difficult because the child does not have the same level of understanding as a parent. And sometimes it's even a little bit different. The way that the child understands one term does not really mean what the provider was trying to tell you. So this is important. And if so, in this case, bring somebody to translate for you. Next, please. So empathy. This is another way of identifying or being able to communicate appropriately. Empathy is the process of imagining oneself in another's place and viewing the situation from the other person's perspectives. Is that concept of putting yourself in someone else's shoes or walking in someone else's shoes. It's that same concept. So in reality, there's sympathy and there's empathy. Sympathy is almost feeling sorry for somebody, and empathy is really saying, you know what, I know what that feels like. And that's what a support group does. A support group does exactly that. It creates a group of folks that have gone through that journey. I myself, I have my own connection to cancer. My mother passed away from stomach cancer when I was 18. I became a caregiver because in my culture, I was the youngest. I was the baby of the family. So it's always been in my culture that if you're the youngest, you take care of the family. You take care of your parents. That means you move into your house and you take care of them for the rest of your life, or for the rest of their lives. So this when I hear support groups and when I hear the need for support, I know how that feels because we didn't have a lot of support. We live in a rural community, just like here. Our closest area of a hospital was about an hour and a half to get to a primary care physician. To get to a NCI certified cancer center, that was the closest one I think was San Francisco. That was pretty far. It was about 5 hours. So I understand some of the barriers that communities like this go through on a daily basis because I've lived it. Next, please. Confidentiality. We heard a little bit about privacy earlier, but in a support group setting, it's very important to know that when you go to a support group meeting, it's a safe place. When you go to whether it be a general support group meeting or a specific type of support group meeting, you should know that whatever you say in that support group, you should be assured that those members of that group are not going to, go out and talk about you in the community or go out and divulge your diagnosis, what you're going through, what your family's going through. Because in a support group, it's not just about talking about your diagnosis, but it's talking about what happened, if you got in an argument with your spouse, or life in itself. Cancer involves more than just the diagnosis. It involves an entire family, it involves an entire community. So, and we'll get to the facilitator's responsibilities. So the facilitator